Hi Elise, my name is Nina and I'm a nurse here. And your mom mentioned that you're interested in getting started on a birth control method for the first time. So we can talk about that for sure. I'm glad you're here. And she mentioned that you're most interested in learning more about the Nexplanon or the implant. It sounds like some of your friends have it. So let's talk about it. We love this method for high schoolers like yourself, and I'll tell you why. We tend to call this method the get it and forget it method, and that's because once you put it in, it's long lasting. It can last up to 5 years, and there's really nothing you have to do once it's in. So you're not going to have to remember to go to the pharmacy to pick up your medications. You're not going to have to remember to take a pill every day. There's nothing you have to do before you have sex to make it work. It's really not possible to make a mistake once it's in. When you see that effectiveness rating, usually it's user error that causes that number to come down. With the implant, there's really no way you could make an error. It's going to work once it's in your arm. So that makes it up to 99% effective, which is just as effective as IUDs and sterilization, actually. So quite effective. So what it looks like, it's gonna be, it's a tiny rod. It's sort of the shape and size of a matchstick. And it gets inserted into your non-dominant arm and your upper arm. And it just sits there under your skin. Again, it's in there, it can be up to 5 years under your skin. A few things about it. So it does not protect against STIs, sexually transmitted infections. So if you're having sex, we would like you to use the implant for the birth control method, and then use condoms or some other type of barrier method to protect yourself against sexually transmitted infections. The other thing is that it's not always effective right away. So if you get it inserted during the first 5 days of your period, it works right away. You don't have to use any other kind of birth control method to prevent pregnancy. If you get it inserted any other day of your cycle, then if you're having sex that can result in pregnancy, you're going to want to use another method like condoms to avoid pregnancy. Once you take the implant out, you can get pregnant right away. So again, it lasts up to 5 years. So when you take it out, we can put an implant right back in for another 5 years. We can switch to another birth control method pretty easily. And if you choose no other birth control method and we take it out, just know that you can get pregnant right away. So if you're wanting to be pregnant, it's a really great method because there's no waiting period. Your body doesn't have to adjust. You're able to get pregnant right away. So how does it work? So it is a hormonal birth control method. It is releasing progestin in your body, and progestin works to prevent pregnancy in 2 ways. The first way is that it is thickening your cervical mucus, and that's going to prevent the sperm from reaching the egg. So if the sperm can't reach the egg, there's no fertilization that happens, and pregnancy is not possible. And so the second way that it works, the hormones can stop your ovaries from even releasing eggs. If no egg gets released, you're not able to get pregnant. So that's how it works. Again, it's very effective, up to 99% effective, just because it works almost right away, and there's nothing you have to do to get it to work. Once it's under your skin, it's working for you. Most health insurance companies do cover the cost of the Nexplanon. Health insurance companies love these long-lasting methods, so it's usually free. If you're concerned about cost, or if you know for sure that your insurance company is not going to cover the cost, let's chat, because we do have some options, and there are some places you can go where the cost out of pocket is reduced. So let me know if that's the case for you. So when we put the Nexplanon in, I just want to tell you a little bit about the insertion and removal process. The insertion is so easy and so quick. It happens right here in this office. First, we're going to give you a numbing shot in your arm in the location where we're going to put the implant. You might experience some twinge or, like a little sting from that shot, but after that you shouldn't experience pain. And then we use a little inserter tool to slide that implant under your skin. The healing takes a couple days. It's pretty normal for you to have tenderness, bruising, swelling, and it might ache as well. But we'll wrap it up for you and give you instructions on how to take care of it at home. It's a very easy process. For the removal, it's just a little bit more complicated, but it's still right here in this office. It takes, not very long, and it shouldn't be painful for you. So again, we're going to give you the numbing shot, and then we make a small incision in your arm and remove the implant through the incision. Again, if you're wanting to just continue with the Nexplanon, we can put a new one in right away. And there is some healing process with that as well. So tenderness, bruising, swelling, ache, all of that is pretty normal after you have the implant removed. The side effects are pretty much like the side effects for most hormonal birth control methods. Headache sometimes, some people experience breast pain, nausea, vertigo, skin changes, weight gain. Those are all kind of normal for hormonal birth control methods. The most common side effect for the implant is spotting. So a little bit of light bleeding, especially during the first 6 to 12 months. Because it's a hormonal method, sometimes your body just needs a few months to adjust to these side effects. So most of the time they go away after a few months. And actually most people experience lighter periods, less painful periods, less cramping, and even sometimes their periods go away altogether. So that is a huge benefit to some people, and a reason why many people choose this method, because you don't have to deal with getting your period, which is great. So that's my little spiel on the Nexplanon. I want to give you a chance to ask questions, but first I'm just going to do a little bit of a review. So again, this is the get it and forget it method, because it's really effective, it lasts a very long time, it's very convenient, and you don't have to remember to do anything to keep yourself from getting pregnant. And it's really small. The insertion and removal process is quick and usually painless, and just a little bit of healing after both of those procedures. I should also mention that it's pretty private. So if you're someone who doesn't want anyone to know that you're on a birth control method, sometimes that's true of people in high school, nobody should be able to tell that you have a Nexplanon under your skin. We kind of put it on the bottom side of your upper arm, and so it's not very visible. And side effects, pretty typical of hormonal birth control methods, with the spotting that might happen for 6 to 12 months. But again, most people experience lightening of their periods, less cramping, or sometimes no bleeding at all. So those are great benefits. I'm going to open it up for questions. So what questions do you have for me about this method?